I am going to go over 7 supplements that can reduce pain, improve function, and reduce stiffness if you suffer from ankylosing spondylitis. I will list them from the least effective to the most effective, backed by real science, not just internet trends. Hi, I'm Dr. Diana Ganita, a board-certified rheumatologist. Every day in my clinic, I see patients overwhelmed by conflicting advice, most of which is given by internet searches, now even by AI-driven searches, or by their neighbor's experience, or even by advertisements that they see on the TV. Currently, in 2024, people spend about $13 billion on joint supplements, and this is expected to grow to $38 billion by 2038 as the global population is aging. Ankylosing spondylitis, or AS as we call it, affects about 1% of the world population. In the US, about 3.2 million people suffer from AS, and many are interested in taking less medication and are willing to try natural alternatives like supplements. But the question is, are supplements enough to keep your disease from progressing? Are supplements for arthritis also good for AS? And which supplements were researched specifically for people with ankylosing spondylitis? Let's find out. Number 7. We'll start talking about Boswellia that gained huge attraction in the last few years. Boswellia is a resin herbal product from Boswellia tree. The boswellic acid is actually the one responsible for the powerful anti-inflammatory effect. Studies have found that boswellic acid can block the COX-2 enzyme and reduce inflammation as well as cartilage damage. A 2014 study that included multiple randomized controlled trials found out that patients with osteoarthritis, which is a form of degenerative arthritis also called wear and tear arthritis, those people that took 100 milligrams Boswellia every day for 3 months had less pain, improved function in their joints without serious side effects. A few other studies in 2018 and also in 2020 confirmed the benefits of using Boswellia in patients with osteoarthritis. But how about patients with AS? Unfortunately, I was not able to find any studies at this time that proved the benefits of Boswellia in patients with AS. But if you decide to give it a try, be careful, talk to your doctor, as Boswellia may increase the side effects of other drugs like antidepressants or anti-anxiety drugs or ibuprofen and immunosuppressants. Number 6. Next, let's talk about CBD oil or cream. Many of my patients will ask me these days, what do you think about CBD oil or CBD cream? Now, research, especially in animal studies, less in humans, showed that CBD had a beneficial effect to reduce pain, inflammation, reduce anxiety, and improve the pain and sleep. Although there are some small studies in patients with osteoarthritis and rheumatoid arthritis that show that CBD may reduce the pain, in patients with AS, I do not find any studies as of today. But if you decide to try CBD, since there are no established clinical guidelines, many experts recommend to start with the lowest dose possible and increase it gradually over the course of a few weeks. But remember, CBD oil or CBD cream will not replace your AS treatment. Number 5. Another controversial supplement on the market, one of the supplements that are frequently bought is Glucosamine Chondroitin. But does this work for people with AS? Glucosamine and chondroitin are natural compounds found in the cartilages of your joints. You can buy glucosamine and chondroitin individually, but most of the time are sold together as a single supplement. Initially, based on animal studies, people got very excited as glucosamine and chondroitin showed to have some anti-inflammatory properties, and they also showed some potential to slow down cartilage deterioration and reduce pain. However, is this as good in humans as it is in animals? Now, one study published in 2008 in 1,600 people with osteoarthritis, the study was called GATE study, looked at the combination of glucosamine and chondroitin versus Celebrex or celecoxib, or versus taking an inactive pill that we call placebo. And the study showed that the combination of glucosamine and chondroitin did not offer significant relief in pain to those that participated in the study, but it did help a small subgroup of patients with moderate to severe knee pain. However, in a follow-up study from 2010, the same supplements improve pain and function, although no better than placebo or NSAIDs like celecoxib. There are a few other studies like the MOVES trial, which was published in 2016, that show that the combination of glucosamine and chondroitin, if you take that for approximately 6 months, was as effective as celecoxib in order to relieve pain and swelling in the people with knee osteoarthritis. Now, celecoxib is a very potent anti-inflammatory medication and sometimes comes with some side effects. But in the same study, glucosamine and chondroitin had no side effects reported. And this is important because if you have a history of heart disease or a history of GI bleed, it is best to avoid NSAIDs like ibuprofen, naproxen, or celecoxib. And instead, you may use these supplements as they are considered safe. However, there are no current studies to prove that glucosamine and chondroitin supplements are effective in patients with AS. Now, I think it makes sense to use them for those patients if you have contraindication for NSAIDs, since they don't seem to have any side effects, but in no way believe that they will replace the treatment of AS. So don't get fooled to believe that they work for any type of arthritis. Let me stop for a few seconds and ask you a favor. I noticed that 85% of you that are watching these videos are not subscribed. If you are finding value in my videos, go ahead and subscribe now before you forget. And while you're on it, hit that like button because it helps YouTube recommend this video to more people who need this valuable information on autoimmune diseases, rheumatology, and more. Number 4. Let's continue with another popular supplement, turmeric or curcumin. Turmeric is a popular spice in the Asian cuisine. Its active ingredient is curcumin, which is responsible for that beneficial effect. In my research, I found out about more than 1,000 studies about turmeric and inflammation, and more than 120 studies were clinical studies. And important, a few studies were done in patients with AS. Curcumin can help inflammation through several mechanisms. It blocks inflammatory enzymes like COX-2 enzyme, which is the same enzyme blocked by NSAIDs like ibuprofen or diclofenac, and in this way decreases inflammation. Studies in people with osteoarthritis as recent as 2020 show that turmeric in a dose of 1 to 1.5 grams per day will reduce pain, inflammation, as well as the need to take ibuprofen or diclofenac. Even in patients with rheumatoid arthritis and psoriatic arthritis, which are other forms of inflammatory arthritis, somehow similar with AS, the results were quite impressive. Turmeric in a dose of 1,000 milligrams per day for at least 90 days decreased inflammation, pain, and the number of swollen joints. Now, how about patients with AS? The results are contradictory. While some studies found it helpful, like this study, other studies did not find the benefits of taking turmeric or curcumin, like this study. My recommendation, you can try a turmeric supplement to replace the need of using NSAIDs, and if it is helpful, you should continue. But again, stay in contact with your rheumatologist and treat AS. Plus, you should choose a product that is enhanced with pepper because that will enhance the absorption of the supplement. But be careful because high doses of turmeric or curcumin can act as a blood thinner or can worsen the effect of blood thinners like Coumadin or warfarin. Number 3. Let's talk about probiotics. The idea to use probiotics in patients with AS came from multiple studies that show that patients with AS have a lot of gut inflammation. Many patients with AS, about 6 to 14%, also have inflammatory bowel disease like Crohn's and ulcerative colitis. So naturally, improving the gut microbiome by adding good bacteria provided by probiotics made a lot of sense. Some studies, like this one, suggest that probiotics like Lactobacillus may effectively slow the progression of AS when used in conjunction with other therapies. Taking Lactobacillus can also help relieve symptoms of inflammatory bowel disease, which, as I said, many people with AS will have. There are also other studies that suggest the benefits of taking probiotics in people with spondyloarthropathies like AS, with improvement in their fatigue, pain, bowel symptoms, and inflammation. But let's also acknowledge that there are also studies that did not find the same benefits, like this study. Now, maybe the dose was not correct. Maybe the type of good bacteria or the strains included in the probiotics were different. Or maybe we need to have more research to understand if probiotics are truly beneficial for AS. My advice: if you are experiencing a lot of gut inflammation, symptoms that will be related to IBD like bloating, diarrhea, abdominal pain, give it a try. Take them for at least 3 months and see if you notice any improvement. If you do, continue. But if you don't see any improvement in 3 months, it is not worth the money. We are getting there. We are getting closer to the supplements with the highest benefit. Number 2. In the last years, omega-3 fatty acids and fish oil gain a lot of popularity. You have probably heard about the benefits of fish oil for your heart, to decrease the cholesterol, the triglyceride levels, but have you heard about using fish oil or omega-3 for arthritis? Fish oil is the source of omega-3 fatty acids, and omega-3s are considered essential fatty acids because your body cannot produce them, so you either take them from food or supplements. There are many studies that link the use of fish oil or omega-3s with anti-inflammatory effects. Studies in people with rheumatoid arthritis, lupus, gout, psoriatic arthritis, osteoarthritis, they did show impressive results. The use of fish oil or omega-3s was associated with significantly reduced joint pain, stiffness, swelling, and most importantly, decreased or eliminated the need to take NSAIDs. In patients with mechanical back pain, one study showed that using fish oil for about 4 months was able to reduce the need for using NSAIDs. Actually, about 60% of patients discontinue to take any NSAIDs. And this is very important to note because there were no significant side effects reported in these studies. But how about patients with AS? A study from Sweden published in 2023 showed that people with AS were having a diet which was lower in several nutrients with anti-inflammatory properties like fiber density, omega-3 fatty acids, vitamin D, and selenium. And they proposed a nutritional screening to be incorporated into the management of these patients with AS. Another study showed that a low level of omega-3s in the body correlated with an increased disease activity in patients with AS. Another study that compared different doses of omega-3 supplementation showed that using a higher dose, like 4.5 grams per day, showed to have a statistically significant reduction in the disease activity. However, this study included just a small number of patients, about 18 patients, so these results require validation. If you decide to try omega-3 supplements, it is safe and recommended to have a dose between 2 and 4 grams per day. If you are interested, I will leave a link to a product from a reliable company, but be aware the results could be variable and I'm not endorsing the use of this specific supplement. The number one supplement that has the most scientific backup is a vitamin. Yes, vitamin D. As a rheumatologist, I see many AS patients with low vitamin D levels. And here is what's fascinating. This is not just a coincidence. Research shows that vitamin D plays a crucial role in the pathogenesis of the disease. Actually, low levels of vitamin D can cause the AS onset in the context of a genetic predisposition. There are also studies that show that patients with AS have lower vitamin D levels, and a lower vitamin D level in these patients was also correlated with a higher disease activity and more inflammation. But what does it mean? When you deal with more inflammation, that will also cause the bones to be weakened and people will develop osteoporosis faster. And not only that, but the low vitamin D level in patients with AS, it's also correlated with an increased risk of mortality. So please take it seriously. A few years ago in 2022, the VITAL study showed a 22% reduction in the risk to develop autoimmune diseases in patients who took vitamin D supplements. The study recommended to take 2,000 international units of vitamin D per day and 1,000 milligrams of marine omega-3 fatty acids again per day. Now, my advice, if your rheumatologist did not check the vitamin D level, you should suggest that. And if the vitamin D level is low, you should start supplementation with vitamin D3. This is a lot of information about the use of supplements in AS, but there is so much more to know and to learn about. So make sure you watch this video where I explain exactly what you need to treat AS.
Rheumatologistoncall.com